Insulin exerts a significant anabolic influence on various metabolic pathways, including carbohydrate, lipid, protein, and water electrolyte metabolism. It facilitates the uptake of glucose in insulin-dependent tissues, thereby enhancing the overall availability of energy for physiological functions. In terms of lipid metabolism, insulin plays a critical role by regulating processes such as lipogenesis and the oxidation of fatty acids. The activation of insulin results in an increase in fat synthesis while concurrently reducing the breakdown of fats, thus underscoring its essential metabolic role. Furthermore, insulin serves to inhibit the excessive formation of cholesterol and the production of ketone bodies. This regulatory function is crucial in preventing metabolic complications, particularly in conditions such as diabetes, where metabolic control is often compromised. Normal cholesterol levels exhibit a range, with a recommended threshold set below 5.2 millimoles per liter for general health and specifically 4 millimoles per liter for individuals with pre-existing cardiovascular diseases. Adhering to these levels is vital for assessing and maintaining optimal heart health. The impact of diabetes on lipid metabolism is particularly noteworthy, as it leads to a decrease in lipogenesis and an increase in lipolysis. These shifts manifest differently in individuals, resulting in weight loss associated with type 1 diabetes, while type 2 diabetes tends to promote weight gain. Moreover, obesity plays a significant role in the development of insulin resistance, which is a primary contributor to the onset of type 2 diabetes. A clear understanding of the distinctions between being overweight and obese is essential for health assessments and interventions aimed at improving metabolic health. In the context of diabetes, the normal equilibrium between endogenous and exogenous cholesterol is disrupted, leading to an excess in cholesterol synthesis. This imbalance not only exacerbates diabetic complications, but also significantly contributes to the development of atherosclerosis in affected patients. Atherosclerosis is classified as a type of macroangiopathy, which primarily affects large blood vessels. This classification underscores the serious vascular complications that individuals with diabetes may experience, highlighting the importance of vigilant monitoring and management of cardiovascular health. In addition to atherosclerosis, diabetes can precipitate severe complications such as gangrene and diabetic foot syndrome, primarily as a result of vascular damage. These conditions further accentuate the critical need for effective management of cholesterol levels among diabetic patients. Ischemic heart disease can manifest as either stable or unstable angina, and in more severe instances, it may culminate in a heart attack. Timely identification of these forms of ischemic heart disease is essential for clinical intervention and the prevention of adverse outcomes. Moreover, atherosclerosis represents a systemic condition affecting multiple blood vessels, leading to potential complications that extend beyond the cardiovascular system, encompassing renal or gastrointestinal issues. Recognizing the widespread impact of atherosclerosis is vital in both diagnosis and treatment. Microangiopathy, on the other hand, involves a complex pathogenesis that is often unrelated to lipid metabolism, encompassing factors such as autoimmune damage and inflammation. Differentiating between microangiopathy and other conditions enhances the understanding and development of effective management strategies. Ketone bodies, notably acetone, present a toxic threat as they can accumulate within the body, leading to deleterious health effects. The brain, in particular, is predisposed to the adverse consequences of these metabolic byproducts. An excessive accumulation of ketone bodies can impede tissue respiration in the brain, potentially giving rise to severe conditions such as diabetic ketoacidosis, which stands as a critical complication of diabetes requiring prompt medical intervention. Diabetic ketoacidosis can result in profound complications, including a state of coma, marking it as one of the most severe manifestations associated with diabetes. This condition necessitates immediate and comprehensive medical attention. Characterized by the presence of ketones and acidosis, diabetic ketoacidosis indicates significant metabolic disturbances. Understanding the underlying physiological processes is crucial for formulating effective treatment protocols. Recognizable symptoms of ketoacidosis include the distinctive fruity odor of acetone on the breath and the detection of ketones in urine. Accurately identifying these signs is essential for ensuring proper clinical diagnosis and subsequent management. Lastly, differentiating between ketoacidosis and hypoglycemic coma is vital for determining appropriate treatment. Each condition exhibits unique symptoms and necessitates distinct therapeutic approaches, further emphasizing the complexity of managing diabetes-related complications.